Go again. Good morning, and thank you for joining this morning's STPRA educational webinar on Chagas disease in your dog. Facts, Myths, and Hope is presented by today's speaker, veterinarian Roy Madigan. I'm Susan Kibbe, Executive Director of South Texans Property Rights Association, which I'll shorten to STPRA. I'd like to thank Dr. Madigan for taking the time to speak to us today on this very misunderstood topic and to bring light to the issue. I'd like to introduce our participating staff who will be facilitating the questions at the end of Dr. Madigan's presentation. Nicole Coates is our Assistant Director, Jennifer Harris is the Membership Services Director, and Lacey Kibbe is our Information Coordinator. We'll be leaving the questions to the end of Dr. Madigan's presentation, so feel free to put your questions in the chat box at any time, along with your name, title, and your location if you so choose. The girls will then present your questions to Dr. Madison after his presentation. STPRA first became involved with Chagas disease in 2012 when our then board chairman, Burton Lawrence, brought it to our attention because he was also serving on the Baylor College of Medicine's board. The STPRA board adopted Chagas disease as an educational issue that year, and in 2014, we co-hosted a Chagas disease seminar with Cesar Kleberg Wildlife Research Institute, hosting expert speakers in their fields. At our following annual meeting, Daryl McInerney from the 4R Ranch in Hondo shared his experience with Chagas disease in his hunting dog kennel and his work with a veterinarian who helped him immensely. Little did we know at the time that this veterinarian was Dr. Roy Madigan. And with that, I'd like to introduce Dr. Madigan. He's a small animal veterinarian who's been practicing in the hill country of Texas for the past 24 years. His clinical research includes the diagnosis and treatment of Chagas and Leishmania in companion animals. His current endeavors include formulation development and application of oral and injectable therapeutics for both Chagas and Leishmania. His past work includes filing the first veterinarian drug patent for anti-T. cruzi activity in dogs and patents on the prevention and treatment of canine and feline leishmania, and conducting pioneer research on the curative effects of drug combinations in humans infected with Chagas disease. Additionally, his team has developed serologic and molecular techniques to diagnose T. cruzi infection in companion animals. He resides in the San Antonio area with his family, a 15-year-old pug named Yuta, a golden retriever named Daisy, and a German short-haired pointer named Rip. Dr. Madigan, the webinar is yours.
Thank you, Susan, and thank you everybody at STPRA for having me. I'm really excited to talk to you guys today about Chagas disease. I'm sure you have a ton of questions, and some of you are probably pretty invested in this as far as having dogs that have had this disease before, and maybe even some pretty bad experiences with the disease, because it is a very bad disease. But that being said, we want to try to educate you guys and give you some encouragement. Just like the title says, we want to dispel some of these myths that are out there and some misinformation, and give you hope with some treatment options and things that you can do at home, do on your property to help mitigate these infections on your property. So we're going to go ahead and get started here. We're going to have, like Susan said, we're going to have some questions at the end. I'm happy to stay as long as you need me to. And if you think of something late tonight at midnight, just shoot me an email. I'll have a contact information up there, and you can reach out anytime. And certainly we work with veterinarians around the world. And so, your veterinarian can reach out to us too if they need guidance, either in the diagnosis or treatment management. We're happy to do that. So, okay, so let's get started. We'll go ahead and advance to the first slide. Can you, yeah, there you go, perfect. All right, so a lot of you probably don't know too much about Chagas disease and how it's spread, how it's transmitted, and kind of what it does in the body. If you've done some research on it, reading on Google and things like that, a lot of attention goes into the effects that it has on the heart. But there's a couple of key points about Chagas disease. Number one, it is a parasite. And unlike heartworm disease and intestinal parasites, which we deal with a lot, it's not a true worm, okay? This is a microscopic parasite. It's a little bit smaller than red blood cells. It's real tiny. You can't actually see it, okay? But it is spread like other vector-borne diseases like Lyme disease that you might be familiar with, heartworm disease with vectors of mosquitoes and things like that. It uses an insect to kind of carry it and infect different mammals, and that vector is called a kissing bug. And on the next slide, we're going to have some pictures of these kissing bugs real time. So actually, we can go back, sorry, but that's what they look like real quick. But whenever these guys show up on the scene, these kissing bugs, the typical transmission pattern is that just like a mosquito, they're going to take a blood meal, okay? And whenever they take that blood meal, unlike heartworm disease, where the mosquito actually spits the worms into the skin, this bug actually poops, okay? And inside the feces of the kissing bug is actually where the parasite lives. And so what happens is, and you can see from this slide, the bite on the skin, you can see the brown stuff. I guess that represents feces. It's leaking into the wound. And when that happens, that parasite gets transmitted directly into the bloodstream, okay? It hijacks some of the white blood cells at that point, and then it disseminates into the pet all throughout every single system. So for illustrative purposes, we're going to talk about like cardiovascular a lot, but the best way to think about it is almost like malignant cancer, okay? It goes to every tissue. So once it hijacks that white blood cell, it goes to the lymph nodes, hits a couple organs on its way to its target, which is the heart in most cases, and then it sets up shop there, okay? Once it gets to tissue, it changes, and it changes into this cyst-like form. It's called an amastigote, and you can see on the picture here on that zoomed in slide, it's like a heart muscle cell, and it's being dilated and expanded. And inside of there, you'll see these little cyst-like structures in there, okay? That's actually Chagas, or T. cruzi, what we call Trypanosoma cruzi, T. cruzi for short. And that parasite starts to replicate, and it divides. And very similarly to a virus, once it reaches a critical capacity, it pops that cell and ruptures, and then all the babies come out, okay? They get into the bloodstream and they complete that life cycle. Now, once it's circulating in the blood, if another kissing bug comes around and takes a blood meal, it's going to suck up those babies, and then it's going to continue that cycle so it can go infect other mammals, okay? It's very important to note on this picture, when those cells rupture and those babies come flying out, that kills that cell. So whether that's a heart cell, it ain't coming back, or if it's a liver cell, or if it's a brain cell. And so you can quickly do the math on it. And if you say, well, if I keep losing these cells, I'm going to start to have pretty substantial disease that we can't recover from necessarily. So very important point right there. So we'll go ahead and advance to the next slide. So you saw kind of a little preview of these guys. So there's 7 different species of kissing bugs in Texas, okay? We'll go ahead and advance to the next slide if you can. The 3 most common ones that we see are the ones that we've included on there. Can you guys see it yet? I'm not sure. It's going. She might be, oh, there we go. Okay, so those are the 3 most common on the right side there that we see. And they pretty much have the same anatomy. So you've got a tiny little pinhead that sucks blood. You've got this giant body, and then you've got these 6 legs, okay? The fat thing on the left is actually a nymph, so that's a baby. And those guys are gonna be, in wood piles, stuck between crevices in your shed or your barn. I mean, these guys aren't just out cruising around in your yard or your back porch, okay? They're gonna be hidden because they're growing and feeding on things that like to burrow and things like that. But they're short and stocky, as you can see, and they kind of resemble their adult counterpart. But basically, these bugs they're active year round. Look, I'm not going to sugarcoat it. Everybody wants to make it like, well, there's a season for kissing bugs. I mean, how many times at Christmas have you, gone to dinner and you're wearing shorts and a t-shirt, right? So it just doesn't drop enough consistently. And the further south you go, if you guys have, property down, heaven forbid, Harlingen on down, you guys are going to be getting, absolutely year-round kissing bug, and we have a lot of veterinarians down there that report that too. So they're active year-round, which means the disease transmits year-round. But generally in the summer months, kind of like right now and through October, we're going to get a lot of Chagas in because of active transmission. Interestingly, the data on how much Chagas is carried in these bugs is pretty staggering. So in Texas, about 60% of the bugs, of these kissing bugs, carry Chagas disease. Just for context, that puts you at Mexico City, into these other countries that we consider Chagas to be pretty bad and widespread. So we're right up there. Okay, there is definitely active transmission here. Outside of companion animals, dogs, cats, horses, and people, the normal life cycle is generally with, possum, raccoon, rats, things that live out there. Okay. Interestingly enough, these kissing bugs, they'll eat anything with blood. Okay. And so we found, frog blood, we found, bird blood in there. Even though those particular animals can't complete the life cycle and, make babies and transmit it to more kissing bugs, they can still provide a food source which fuels these things and helps them mature so they can go out and complete the life cycle with our companion pets or ourselves. We'll go ahead and advance to the next slide. This method of transmission, the oral transmission, is actually the most common transmission in the dog and the cat. So I talked about the classic transmission with the bite and the feces and stuff, and it's an important transmission cycle, especially in people, but this is what gets us right here. Okay. And I'm sure most of you have dogs, right? They're hardwired for it. They're going to eat anything smaller than themselves, especially if they eat a bug and it has blood in it. Man, talk about an instant reward that you can never untrain. And so it's not just, hunting dogs and, I call them type A personality dogs, the terriers and things like that. And no offense, Daryl, the English cockers, which I love, but they're dynamite, right? Dynamite with 4 legs. But this behavior is super common, where they're going to eat these bugs. Okay. The problem is with oral transmission, when a dog or a cat or a human for that matter accidentally ingests these kissing bugs that are infected with Chagas disease, it takes the parasite exposure in the body to another level. Okay. So most of the time when a bug poops and they poop into a wound, they're getting about 50,000 parasites. When they eat a bug, man, you're getting 3 to 600,000 parasites. You went from 50 to 600,000. That has an impact. Okay. I mean, the immune system. So the immune system's radar, whenever it gets hit with that many, it can go crazy and go haywire, and it can respond very inappropriately, which is why in dogs and cats, we see a higher mortality rate. So more dogs and cats die than in humans because of the entry point, if you will, of how that parasite's getting in there. Okay. So in people, they've studied it pretty extensively. There's a 300% increase in mortality rate if you ingest something orally. Now, people can get it, hopefully they're not eating bugs, but some people do. In some cultures in South America, they believe that eating the kissing bug, restores vitality and can treat certain illnesses. And so they're actually actively eating it. But the majority of the time it's on an accident, and they're getting incorporated into juices and drinks and things like that. It's in food. So it's like, oops, but they have the same effect, pretty high mortality. Okay, we'll go to the next slide. This is just a picture of someone sent me in South Texas. This bowl of kissing. Those are all kissing bugs, by the way. One night in the summer, and that's how many she caught. So dogs have ample opportunity to be exposed to these bugs and eat. And again, they taste pretty good if they have blood in them. So we'll go ahead and go to the next slide. The other another form of transmission is congenital transmission. And some of you breed dogs. Obviously, if you're buying a dog, you're getting it from a breeder. And, congenital transmission definitely happens. So from mom, from the bitch to the babies. All right. And not much is known about it as far as, in a controlled study environment in dogs, but we know in humans that it's about a 5% transmission rate. And again, put it in context, HIV transmission from mom to baby is about 1% to 2%. So much better method of transmitting than even HIV. But 5% isn't bad, especially if you're having, one baby at a time. But remember, your litter of 15 puppies, that's 15 independent events at 5% each. You're getting up there, okay? And I've seen it before where I've had, one puppy out of a huge litter have Chagas. I've seen it where all puppies have it, okay? But regardless, if you're in a breeding program, it is critical that the testing status of your bitches that are breeding, because there's nothing sadder than having to go through an entire litter that died. Okay, it's heartbreaking, and they're not going to die right away. It's going to take a little bit of time usually. So the majority of the time, from my perspective as a veterinarian, what I'm seeing is puppies that are small, they're poor doing. Something isn't right, and if you have a seasoned breeder, they're calling you. They're going, hey, I don't know what's going on here, but we need to look at this. The other thing that we see due to the popularity of the French Bulldog, because of social media, we see a lot of breeding with that, and those guys have to have C-sections, and so we see a lot of heart arrhythmias under anesthesia, and that tips us off to that. And fortunately, we've been able to save a lot of dogs, diagnose mom right away during the C-section, or index of suspicion's high, so we can start mom and puppies on treatment while we're waiting on testing to come back. But a very, very high mortality rate if they get it. So we'll go ahead and go to the next slide. This is our prevalence slide right here, and I'll explain the numbers in a minute. But if you cast your attention to the right there, this is the map of kissing bug distribution, not Chagas disease, but kissing bug distribution in the United States. Interestingly, Hawaii has it. I think I might have to make a trip out there just to verify that. But you can see it's like the southern 26, 28 states, the kissing bug, it's there, okay? And what's happening right now is that we're having a lot of travel, and a lot of that's driven by rescue organizations and things like that, where they're adopting dogs in the Northeast and the North, or even going as far as Canada, because believe it or not, they don't have stray population problems up there, and people want dogs. And so a lot of dogs from the South, probably ever since Katrina, we've been kind of shipping everybody out there. And so a lot of the dogs, at least from Texas, will come from South Texas, where there's even more Chagas than here. And so we'll be shipping them up there with that, plus heartworm or some other fun diseases that they can play with. So we're seeing it in all 50 states and definitely in Canada. And we're seeing it in other parts of the world now, again, just because of travel. So, but this kind of gives you an idea of, where our hot zone is, and basically anything in orange. So on the left, these numbers, in black, we have Chagas published prevalence rates. So for example, let's pick on Louisiana. They're always fun to pick on. 22% Chagas positive dogs, and that's in companion animals, okay? It's a lot of dogs. If you compare that, again, context-wise, to heartworm disease, that's Louisiana's heartworm numbers right there, 7.1%. So let's say 7% of dogs have heartworms, 22% of Chagas. Now jump down to Texas, which we have the most data in Texas, not because we have any more than any other state, it's just because we look for it, okay? But, depending on the population, 8 to 31%. So up to a third of dogs in Texas right now have Chagas, which equates to about 1.5 to 2 million dogs, okay? And then compare it to heartworm, 3% positive rate. It's kind of the elephant in the room, right? But it kind of gives you an idea of how much Chagas we have versus heartworm. In fact, if you take all the infectious diseases that we screen for routinely, so things like Lyme disease, other tick diseases that we have more than Lyme disease, you take intestinal parasites, you take heartworm, and you throw all those together, it comes out to be about the same number as the number of Chagas patients that we have in Texas. So it's a big problem here, okay? Another interesting thing is, at least it was interesting to me, was that if you shift all the way west to California, they've only looked at like San Francisco. Well, they've only published in San Francisco, so Marin County and around there. So if you've been to San Francisco, it's like super urban, and then you go outside and then it's very rural. And so they kind of looked at in the county, and then they looked at downtown San Francisco. And surprisingly, 15% of shelter dogs in San Francisco downtown tested positive for Chagas, which was really surprising to us because, it's kind of chilly up there. You wouldn't really think that the kissing bug could kind of thrive there. And again, compared to a 0.5% for heartworm disease is pretty staggering. Okay, we'll go into do the next slide. All right, so this is a question we get a lot. What breed is the highest risk for Chagas disease? And surprisingly, again, bulldogs, both English and French bulldogs. And I think, again, I mean, if you've ever had one, I mean, they're no more goofy than any other dog. I mean, they eat bugs just like anybody else. But I think, again, due to the popularity, I think, by the time you drop $5,000 to $10,000 on a dog, if anything's going to go wrong, you're going to go to the vet and have it worked up. So I think there's a lot of variables there that kind of contribute to that. But it was pretty interesting to see that bulldogs, rank at the very #1 dog for that, followed by German Shepherds, Chihuahua. Clearly, that was a surprise to me, but they do things other than the owners holding them all day. They do eat bugs. But the interesting thing to me was, the overall prevalence of Chagas disease in Texas in companion animals was 16.8%. So 17, 18%. This is all A&M's data. Again, shelter dogs in Texas, about 18% as well. So, the conclusion is it doesn't matter if you have an outdoor dog, indoor dog, shelter dog, an AKC Grand Champion hunting dog, they're still all at risk, okay, by merely living here in Texas, okay. The other thing is, main reasons for testing were the veterinarian detected an arrhythmia, so an abnormal heartbeat, okay, so not necessarily a murmur, but an abnormal beat or rhythm. And then the second thing, and I would agree with this 100%, is that, I've got 7 dogs and one of them had it, so I'm testing everybody else. And we'll talk about that a little bit later with the diagnostics and things that we can do to help prevent it. Okay, next slide. All right, so I'm going to be real brief on what Chagas does. Okay, that's what pathogenesis is. So the development or the genesis of disease and what this parasite is doing. So what's it doing behind the scenes? Why do I need to be worried about it? Is it just an infection? I'm going to get a little itchy from the bite and that's it. What's going on here? So essentially, Chagas does 2 main things in the heart. Okay, again, we're focusing in on the heart mainly at this point. Okay, we're not going to talk too much about what it's doing in other body systems, but the #1, and this is a huge take-home point I want you guys to remember, is it's going to mess up the electrical conduction of the heart. Okay, it's more of an electrical problem than it is a pump problem across the board. So about 90% of dogs with Chagas disease are going to have serious electrical disturbances. Okay, the actual numbers from a paper we just published a few weeks ago, 98% of dogs, regardless if they had symptoms or not, had electrical disturbances. Okay, but I say about 90% of dogs overall are going to have like significant ones. Okay, so it's going to mess up the electrical conduction. Why is that bad? Well, you want your heart to follow its cadence and follow the natural pacemaker in the body. We want to have that order. Okay, when that gets disrupted, okay, then we start to get arrhythmias, which can be fatal, and so they can quickly die. It can progress or escalate very rapidly. So that's the first thing, electrical disturbances. And so the second thing, and a lot of people focus on this, but it's only about 10% of the dogs get this, is the pump can go bad, okay, what we call systolic dysfunction. So the muscle itself gets so sick that they go into that classic heart failure, okay? So if the right side is failing, and we're gonna have a picture of this later, you're gonna get a really big distended belly, okay, full of fluid. The pump's backing up on the side. If it's backing up on the left side, we're going to get lungs full of fluid, so it's going to look a little bit different. But basically, the pump's starting to fail. So those are the 2 major things, okay? And the end result of that is that we see this extensive cardiac ventricular remodeling. So the heart gets big, it gets dilated, it gets thick, and so that can really, really mess us up, okay? So we'll go ahead and go to the next slide. The end result, too, is that the more inflammation you have from Chagas, the more scar tissue you have, and it is a progressive disease. So it's real important for us to know that. Okay, so these are some pathology slides here, okay? I won't bore you with it too much, but it does help you kind of understand things. So on the left is normal dog heart tissue, okay? Everything's in order, it's pretty simple. We've got pink, we've got purple, we've got some little white lines in there where the muscles are, separated. And then you look on the right side, okay, and you can see a lot of disorganization. It's almost like the sheet, and then there's this purple, being kind of intermixed with all this. And there's a lot more purple on the right than the left side, okay? So why is that? The purple represents inflammation. This is what we call the acute phase, not cute, but acute phase, which means within the first 8 weeks of exposure, this is what's happening to some degree in the heart, okay? It's characterized by a lot of inflammation. You're sick, okay? Your body's trying to fight off this parasite that just set up shop in their heart. And so it's sending in a lot of inflammation, and that can cause problems, okay? Just like when your nose gets inflamed, it runs. Well, when the heart gets inflamed, it can do some pretty bad things. It can actually do those things we just talked about, those 3 things. So this is kind of what it looks like. Now we're going to go to the next slide. And now I want you to compare this one to this one. Okay. So you notice some difference here. Now it is way out here. Okay. But we wanted to capture the effect of this. Okay. There's less purple. There's a lot more white in there. Okay. So what's going on here? This is the chronic phase. Okay. This is what happens to every single dog that gets Chagas disease eventually. Okay. You get enough inflammation, those cells pop, right? Those little cysts in there pop, and the babies come out, that cell dies. You get that happening enough, and then you get this. You get all this white dispersed throughout. The white represents fat and scar tissue, okay? White is not functional. There's a hole there, okay? There's no muscle there. There's no heart muscle. This heart is sick. You lose enough heart muscle, you can't pump, you get those electrical problems that we were talking about, the dogs die. Okay, this particular dog had 70% damage. Okay, and she had been through treatment. By the time we got to her, she's pretty sick, but she lived another 3 years with this. It was a real old lab, and she was actually able to run and fetch and play at 13 and a half years old with a heart that looked like this. Absolutely incredible. I have so much respect for dogs. They're way tougher than we are, but that's how tough these guys are. We'll go ahead and go to the next slide. All right, so not to gross you out if you're eating lunch, but these are kind of different stages of Chagas disease, okay? The heart on the left, that's a heart. It's huge, okay? It's purple, it's discolored. If you were to hold this heart, it would feel very, very heavy, okay, with fluid or edema. This is the acute phase. This is that first slide where we had all that purple everywhere. It's heavier because it's like a runny nose, right? You got a lot of fluid in there from the inflammation. You got a lot of extra cells in there, which actually carry weight. And it gets very, very angry and purple because of all the extra blood flow and the inflammation and congestion that's in there, okay? The middle one and the one on the right are, these dogs are not pregnant, okay? This is actually what they came in for. They're like, I know they've been spayed, but they are really, really big, and I'm worried that these girls are pregnant. And these are 2 different owners, okay, at 2 different time points, but you can see how dilated this is, okay? This is all fluid, and you have a bulldog right here, and then just a mutt from the Humane Society on the right side. These guys had so much scar tissue in their hearts from the chronic phase that the right side of the heart failed, and then all that fluid built up in the abdomen. Okay, and that's what we're seeing there. And you're talking like probably in this middle dog, maybe 1.5 liters. The one on the right, maybe a liter on a 20-pound dog on the right, 40-pound on the middle. So pretty impressive amount of fluid that you can get. But this is actually one of the chief signs that you can see in younger dogs generally, or in dogs that have had it for a really long time. Other diseases that mimic this would be heartworm disease. Okay, I remember in vet school, working in East Texas, we had a lot of dogs that would come in with heartworm disease, end-stage heartworm disease, again, causing the same effect with that right-sided heart failure. So it's not always Chagas, but a lot of the times it is. We'll go ahead and go to the next slide. All right, so this is probably the most important slide. And, I think Nicole's probably going to email you guys a copy of this if you want it. But this is a real important slide to give you to your veterinarian, okay? If anybody's giving you any pushback, just show them this, okay? This is the mortality rate slide. This is what happens if you don't treat Chagas disease, okay? There's 4 papers here. Basically, this is all we have on mortality rates on dogs. How many dogs die if you don't treat them, okay? So take home is 25 to 42% of dogs, 1/4 to 1/3 of them will die within 2 years of diagnosis if we don't do any treatment. Okay, that there's no other parasite that'll do that with that high of a mortality rate. Yes, there are some viruses and bacteria, but parasites, heartworm disease won't even do that. Okay, this is a bad parasite. Okay, and the reason that they die from it, again, we talked about that. Yep, about 10% will get pump failure, but the big one is on the right. Okay, this is an EKG, and the first 2 beats on the left, those kind of smaller beats, those are normal. We call normal sinus rhythm. The body's natural pacemaker is doing its job. Everybody's following. And then all of a sudden, you see these giant waves, okay? And they're real fast. There's a bunch of them. They're really tall. This is what happens with Chagas. It hijacks that pacemaker, and this is called ventricular tachycardia. This dog is going to die, okay, unless you start treatment yesterday, okay? Bad stuff. But this can happen in the middle of the night. It can happen in the field while you're dove hunting. It can happen. I've seen it happen after they bathed a dog and it was doing the zoomies in the yard because it's so happy and it just whoop, that was it. So this is why we treat dogs. Okay. Now compare this mortality rate with humans. Generally about 30% of humans will progress with their heart disease. So it's much, much less. Again, there's a lot of factors for that, but in humans, what they don't tell you, they say, yeah, 30% of dog or of people can progress with their heart disease. But what they don't tell you is that half of those people don't wake up. Okay, they die suddenly. Okay, so they get the same thing, probably at the same numbers, but it can be very, very devastating to your family. Obviously, every night you go to bed, you say goodnight potentially for the last time. So it's very, very similar in dogs and people, but again, dogs have that higher mortality rate generally because they're eating these bugs and they're constantly getting exposed. Okay, we'll go to the next slide. And on that, you don't have to go back, but on those papers, some of your vets are going to want, especially like the specialist cardiologists, they're going to want to know, where did they get this information? You just give them those papers and they can have fun with it. Okay, that'll usually satisfy their curiosity, and hopefully it'll make them take it seriously. So how do we diagnose Chagas disease? Okay, we know what it does, we know where it is, we know how it's transmitted, but how do we as veterinarians find out? How do you as an owner make sure that you're kind of doing your due diligence with this? Okay, some indirect methods of diagnosis. So basically, ways that raise a red flag would be the EKG. Okay, so just like in humans, we're measuring electrical conduction with little leads. Okay, most veterinarians have these now, especially during anesthesia and surgery, so they're monitoring these things. We probably diagnose a third of our cases during anesthesia, but just because we run EKGs on everybody and it's a very, very common abnormality that we see. We're going to see a lot of different arrhythmias. Any arrhythmia raises my eyebrow. Okay, so my staff knows. They see one, they get blood automatically, and then they tell me. I'm like, yep, good, and we're done. And there's a lot of reasons for these arrhythmias, but most of the time it's the presence of the parasite plus inflammation in the heart that's going to be causing that. Okay, not necessarily scar tissue. Diagnostic imaging. Your dog goes in comes in for coughing. We do an X-ray. We're like, oh my gosh, this heart's huge. And this is a picture of a very, very dilated, very large heart with the dog with Chagas. That's going to be something that we're going to look for. Okay, you're going in, to the cardiologist because you want to get, make sure your Doberman doesn't have heart disease, so you can breed her. And they're scanning. The cardiologist is doing an echo, and they're like, hey, something's wrong here. We have a dilated heart. We have poor contraction. That's going to trigger us to run Chagas too. Okay, so incidental imaging. I've had it too, where Fifi is vomiting. We take an X-ray and we're like, hey, did you know that the heart's big? Well, let's work that up. Okay. So again, indirect way of kind of diagnosing Chagas disease. Pathology, basically blood samples. You're coming in for routine blood work. Maybe we have a lymph node that's big and we're going to aspirate it or take a little sample of that, look under the microscope. We could potentially see the parasite under the microscope. And I know it's pretty tiny, but on the left down here under necropsy, that little purple thing is one of those babies. We call it a trypomastogote for T. cruzi. Those little circles are red blood cells. So you can see it's a little bit smaller than red blood cell. And you can actually see those in certain phases of Chagas disease. On the right, this is from a lymph node aspirate. And that cell right there is a white blood cell. And inside are those little babies we were talking about. Okay, so this Chagas organism actually went inside of a white blood cell and started replicating. Pretty crazy. Okay, next slide. The gold standard for diagnosing, even though we have all these red flags, okay, the gold standard is what we call serology. And what that means is that we're actually looking for the body's response to the parasite. Okay, so I'm not looking for the parasitic cell floating around. I'm actually drawing blood and I'm looking for antibodies. So what's the body doing in response to this parasite? Okay, if we have a positive sample, so if that serology is positive, we're going to get a number back. Okay, and it's going to help us interpret it and how long you've had it and things like that. But if that number comes back positive, your dog has Chagas at that point in time. Okay, and we'll talk about some caveats at the end there. There's basically two different methods or platforms that we can use. One is called the IFA and one is called the ELISA. lab people love acronyms, okay? But basically, there are two different ways to detect antibodies. The end result is the same. We're getting antibody detection, okay? The IFA is a very, very old 1960s technology that uses fluorescence. And so consequently, the sensitivity is lower. And you can see there 34% sensitive. Now, what does that mean? It means 1 out of 3 tests, if I took 3 dogs and I tested all of them, 1 of them is going to show up positive, 2 are going to be negative, okay? It's pretty crappy sensitivity, okay? But it's what we had forever, okay? Now what we have is below it, it's called the ELISA, okay? And it uses a laser, similar markers and everything, but it uses a laser to pinpoint levels. And that jacks that sensitivity up to about 90%, okay? So in the human field, ELISA for T. cruzi detection, for Chagas detection is the gold standard, okay? And so fortunately, we have that available now. It is available commercially, but it's not at any of our reference labs right now, but we're trying to change that right now, okay? So when you talk to your veterinarian about testing, most of the time they're going to kind of default to the IFA, but we want them to use the ELISA, okay? And so that's a good talking point that we usually talk to your veterinarian about, so they can open up an account with the lab here in San Antonio so they can actually run the more sensitive test, okay? The other one is PCR, and everybody knows what PCR is from COVID, but basically it's using molecular techniques or amplification techniques to take tiny amounts of parasite and amplify them so they can detect them, okay? So it's direct parasite detection, if you will, okay? And we usually do this on whole blood, okay? We can do it in the tissue, but it's usually just drawn blood and we're looking for it, okay? In the acute phase, so that phase within the first 8 weeks, we've been exposed. We're sending all that inflammation. Almost 100% of the time, we can find it. Okay? And I would say about 100% of the time. In the chronic phase, though, that sensitivity drops down to 51%, so pretty low. Okay, so we don't use this routinely to diagnose Chagas disease. There are some exceptions, but generally we're going to go for that serology. Okay, we use PCR mainly to confirm that we have cleared the parasite after treatment. So next slide. And this is just more updates on the ELISA, more sensitive. The lab that we use is called VRL. And again, if your vet calls or emails, we'll give them this information. And it's a better test than the IFA. We developed this test below called the lateral flow assay, or LFA. It's based on pretty high-tech stuff. In fact, it's the most accurate test that we have available currently as of April of 2025. It's going to get approved. It's not out yet, but we made this test for a variety of reasons. But your veterinarian can run it in hospital within 10 minutes, have an answer, and it's extremely affordable. Okay, I mean $35, $40 to run the test, and we did that on purpose. We've also paired it with a heartworm antigen detection. So part of your annual visit, you go get your heartworm test done, and we're going to go ahead and check for Chagas as well, so we can keep on top of that. But that's in the process. Okay, it's not out yet. Okay, next slide. All right, so this is to remind me to tell you again how important the EKG is, or the ECG. It's critical, it really is. And you can see on the right, we've got a cat. Even cats can get EKGs. Okay, this fat cat with Chagas disease. We're doing one on there, and you can see the little inlay there. You can see those VTAC again, and then a normal beat, and it goes back to abnormal. This thing is so critical to early detection of Chagas. It's crazy. Okay, so highly recommend that. And we also use it to monitor our therapy, right? So once we start drugs, we want to come back and do that EKG and make sure that we're addressing these arrhythmias so we don't die. Okay. The Doberman on the right, that tiny little thing, you see the little blue circles and the tiny little thing, that's what we call a Holter monitor. Holter monitors are basically, they're EKGs, but they're 24-hour, what we call continuous monitoring devices. Okay, so we shave a little area, we slap that on there, we put multiple layers because dogs tend to get a little rambunctious, and we put it on, send them home, be a normal dog for 24 hours. We come back the next day, and then we upload that, and we get a very intense and scrutinized look at the heart and what it's doing. And we love these Holter monitors. We recommend this on every dog before treatment and after treatment, but we really like it because we see dogs at high speed, low speed, and everything in between. Okay. And interestingly enough, in humans, they call them exercise induced arrhythmias, or EIAs. And it's basically, you've heard of people when they're on the football field and they die, or they're playing soccer and they drop dead. Those events, nicely coined, right? Those events happen with activity a lot of the times. And so we see the same thing in some dogs, but what we're seeing is that it's not necessarily exercise, it's more excitement induced. So I see worse arrhythmias in dogs when it's feeding time and when owners come home. So that should make you feel good as a pet owner. You're like, yeah, my dog likes that better than retrieving the ball. He likes me better and food. So pretty good. Most of the arrhythmias will actually resolve after the first month of treatment, okay, which is nice because some of the arrhythmias we have are really bad and can be fatal. So we'll do the next slide. All right, so we're going to talk about treatment. And again, the purpose of this is to encourage you guys. Okay, we're not going to get into semantics and what it's doing pharmacologically unless you want to, but we're just basically broad overview. This is more for veterinarians, but I want you to know so you know what to ask for. Or if they tell you a different drug, you can be like, I don't know about that. So basically, there's only one drug combination that's been proven to be both safe and effective, okay? And that's this right here. And we'll talk about some other treatments briefly. But there's two drugs, amiodarone and itraconazole. These are both drugs that have been repurposed for other reasons, okay? So amiodarone, for instance, it's an antiarrhythmic. We use it to treat those arrhythmias that you saw on those past slides. And we certainly use it for that reason, okay? It's nice not to have any arrhythmias during your treatment so you don't die, okay? But it also has an amazing side effect of killing T. cruzi, okay, kind of important. And it targets it on multiple pathways, which is nice for resistance, okay? And I put some doses on there, that's not important, but we get this you can get it at HEB, Walmart. I mean, everybody has it. It's a critical drug on the human side, so literally everybody has it in all countries. So easy to get, okay? Itraconazole, that's our other drug, it's an antifungal. So we've been using it since the 80s to treat really bad fungal infections. In dogs and cats and really any species in humans. But again, it also targets a pathway that T. cruzi has. So T. cruzi and fungus use the same exact pathway to make it steroid, which is called ergosterol. And so we're just inhibiting that, okay? It's real simple. I mean, drugs are usually pretty simple. And we have the dose on there, okay? The thing is that when we use either one of these drugs, okay, we're going to suppress the parasite, we're going to kill it, okay, but we're not going to necessarily eliminate it. Okay, so our goal is to eliminate the parasite. Okay, these other drugs that have been around since the 80s, outside of these two, they've kind of shifted the expectations, at least on the human side, and it's spilled over a little bit into the veterinary world. They don't have that expectation because the drugs are not very effective. So their goal is to reduce or eliminate cardiac side effects so they don't die as soon. Okay, our goal is, yeah, that's important, but we need to eliminate it. Okay, and it's never been able to be done until these two drugs came out. Okay, or until they were combined. So the magic happens when we put them together and we get that synergism, okay? These drugs are safe and the FDA considers them to have mild side effects, which means they're dose dependent. So for instance, number one side effect that I see, decreased appetite, okay? Usually happens within the first week or two. What do? We lower the dose and the dogs are fine, okay? There are some other potential side effects, but again, they're all dose dependent. No dog has ever died from being on these medicines or gone into liver failure or anything crazy. So if your veterinarian can use these appropriately, and we have plenty of drugs that do this, they're very, very safe, okay? And the downside is treatment is for an entire year, okay? It's 12 months of treatment. Not by choice, but by design. I mean, the parasite is tough, okay? As soon as we put any drug pressure on this from any of the drugs that are available, it stops replicating, okay? And so we have to basically outlast this and have the perseverance that we have so we can eliminate the parasite from the system. Okay, we'll do the next slide. All right, so before I talk about environmental control, I do want to cover real quick about other therapies because I took that slide out because it's just real busy. It's mainly for veterinarians. There are some other drugs out there that have been used in the past. You might read about things like called benznidazole, nifurtimox, allopurinol. There's these real long names of these drugs. The main one, benznidazole, has gotten a lot of looks for the past, 40 years. Mainly because it was the first drug that actually did kill some of the strain types that we see with Chagas. In a very brief overview, there's multiple strains of Chagas out there, okay? And it's very regional. So what I mean by regional is like Texas or the South, in the United States compared to, the southern cone of Peru. So way down there by Antarctica. So those guys, you can imagine there's a lot of distance, right? There's going to be some genetic differences that might be important. And so certainly we see that with like drug resistance, okay? So there's certain countries, Argentina, for instance, that have pretty wimpy strains, meaning they're susceptible to almost every drug. So that benznidazole works pretty dang good down there, okay, if the people and the dogs can tolerate it. But the problem is that the majority of the world, so 70% of the world, probably higher than that, probably 80%, have really, really bad strain types that are inherently resistant to those drugs. Okay, so that's the main reason we shy away from that. Now, it doesn't stop people from looking and trying and doing experiments. And A&M is one of those schools that I would say kind of has to make their mistakes on their own so they can learn things, and that's fine. That's what they choose to do. But they're going to be pursuing these things, and essentially they end up not working because of data that we already have from 30 years ago. But you'll hear conflicting, I want to use this drug, or I want to combine it with these two drugs or whatever, and so you might hear different things about that. But at the end of the day, the highest success rate is with this combination, and that's why we go to it as a go-to on our first try. Okay. So now what can you do, okay, at home to have some control over all the Chagas disease that's out there that we talked about, okay? And environmental control is very important, but it's not everything, okay? And we'll talk about putting it all together at the end, okay? To kill the kissing bug, or what we call vector control, we use a class of drugs called permethrins, and that's what's generally recommended, at least by, bigger agencies. Okay. Now there are other compounds, Deep Woods off, those things that they definitely work. And I think they're awesome. But they might be a little bit harder to get on your big properties. Okay. But definitely talk to Daryl about that. He's had some fantastic success with that, and anything that works, I'm all for it. Just short of DDT, of course. But these permethrins, are a general class of drugs. They've been around forever. They kill anything. I mean, scorpions, roaches, mosquitoes, everything. But they also kill the kissing bug. And the specific one that we like is called permethrin. Cypermethrin. And that's just a specific permethrin. Okay, so that's the big umbrella. The trade names, Home Depot has like Home Defense. Okay, Tractor Supply has Demon Spray. Okay, so these are kind of the cute little names that they give. But all you have to do is, look on the ingredients, and it'll have a long name, and it'll be like in parentheses, cypermethrin, and that's the one you want. Okay, they tend to have, quick knockdown power. They last longer. They're UV resistant, which is, some of the older permethrins, UV light inactivates it. It's like, well, welcome to Texas. We have that problem, guys. And of course, rain will dilute it or inactivate it if you're, closer to the coast or Louisiana. The other way you can do it, or, it's not like an either or, it's just like we do everything, right? So we're going to treat the environment. We're going to focus on the places that these kissing bugs are. So wood piles, brush piles, barns, anywhere where they have cover, but more importantly, anywhere that there's food. Okay. So where are the mice? Where are the rats? Where are the, the burrowing animals? Where are the birds? Those guys are going to draw these kissing bugs to those areas. What I do at my house, and I only live on 2 acres, but I spray thresholds, so doors, and I'll also spray maybe 6 feet out from that, and then also have a dog kennel, and I'll hit that area too. Okay. The other thing that we do is we do systemic control. So, something orally that the dog can take that's going to circulate around. So if the kissing bug takes a meal, it's going to die. It's not going to reproduce. Okay. Obviously, the dog is still going to get exposed if the bug's dead and it eats it. Okay. And it can also, the bug can still defecate right after it takes a blood meal, but you're still, over time, you're going to reduce the population of kissing bugs in your environment, which is what you want. So all the isoxazolines, which is a general class of drugs that we use for flea and tick control, and like every company has one, okay, but the studies have been done with Bravecto and NexGard. They kill them, okay, which is nice. Okay, you're gonna help reduce the kissing bugs in your environment, which is important. And if you've got a couple thousand acres, it's certainly going to be more cost effective than getting out there and spraying everything. Okay. The other point I want to make, and this is super important, okay, on controlling this long term, you got to play the long game, right? Dogs are considered the #1 reservoir for Chagas in the world. Okay, so if you lined up every mammal out there, in birds and frogs and snakes, bugs, kissing bugs would always choose dogs. Okay, I guess they taste good and they're accessible. I don't know, but they love dogs. So if you don't eliminate Chagas disease in that #1 reservoir, which is the dog, you're going to have problems and you'll always be fighting it. Okay, but if you do eliminate it in the dog, you're going to have great success, and your numbers of Chagas infections are going to plummet. Okay, which is huge. So that's very, very, very important. And this is just one piece of the puzzle to help control that in your environment with your dogs. Okay. Okay, we'll do the next slide. All right, so I'm going to just briefly go through a couple cases just to kind of pull it all together, and then we'll have a little summary at the end, and we'll finish up and take some questions, okay? So we'll go to the next slide. So this is Remy. She's a cute lab. She presented to the emergency room in Bernie with just diarrhea, and the vets over there, very thorough. Can't say enough good things about them. They detected an arrhythmia, and they immediately thought of Chagas disease. So they did kind of a workup. She came to me the next day. They sent off a test for it, and they used, we'll hit a couple of points here in a minute, but they sent off for the IFA, right? So most vets are going to do that just because of tradition, right? It's familiar, it's what's out there. And then they came to us. I confirmed it, found a murmur that day too. It's like, okay, what's going on here? We need to do some further testing and scanning. And while we're waiting on the Chagas test to come back from the emergency room, I'm going to go and send off for the gold standard one, the ELISA. So we sent that off. So before we get to the next one, I'll just say, I'll fast forward. The test came back negative on the IFA and positive on the ELISA. Okay, so very, very common. Remember, I have a test that's 34% sensitive. That's the IFA. It's going to miss 2 out of 3, and it did. And I've got an ELISA, which isn't perfect, but it's better. 9 out of 10 it's going to find. It's only going to miss 10%. We were positive, okay? So we'll do the next slide. So we did some, well, actually, yeah, I think they did the chest x-rays, and then we did the echocardiogram, which I'm sorry, I have a video of it, but we can't show that. I'll just show a still picture of it. But basically this x-ray to view the chest right there, that big gray blob in the middle is the heart. Okay. It's big, and you can see it on the VD, which is, the dog laying on its back. The left side of the heart, which is actually the right side of your screen, it's got a little L on it. You can see how big that gray area is on that heart. I mean, it's just way bigger than the right side, okay? So we had a dilated heart. We did an echocardiogram, which is basically an ultrasound of the heart. And we found that this dog, we diagnosed it with DCM, or dilated cardiomyopathy, had really bad, the pump was bad, okay? We had arrhythmias too. So this dog had both electrical and mechanical, or the pump was going out. So that bad, okay? Dogs don't do well with that, okay? And then we'll go ahead and go to the next slide. We did a Holter monitor on her too, which we'll go over in a minute. So basically, these are some measurements. Don't worry about it. This basically on this ultrasound right here, you've got a big black dilated ventricle right here. It's not supposed to be that big, and I wish I could show you the video on it, but it was just barely contracting at about 10%. Okay, generally dogs are going to be well above 20%, usually in the 30s, as far as how much contraction they're doing. So this dog had very poor function and a very big dilated heart. Okay, we'll go ahead and go to the next one. So this is the Holter report. This is just a section of it here, and I put a little bitty red arrow here just to show you this. This is what we call premature atrial contraction. So this is a premature beat arising from the top of the heart versus the bottom of the heart, and it can be very subtle, okay? But this dog had multiple ones of these of arrhythmias up top. Why does that happen? Well, we call this atrial irritability, or if it's happening in the ventricles, which is below, it's called ventricular irritability. It's basically little spots in your atria that are misfiring, and they're misfiring early because there's inflammation there. There's parasites there. So some of you may have or know people with AFib. Similar concept. It's not inflammation that's doing it. It's actually scar tissue that's doing it in humans, but it's the same net effect. It's just with AFib, that is happening all the time, okay? Versus, oh, here's one, okay? So she also had a very slow heart rate. We call that bradycardia, and that's something that Chagas loves to do. It loves to mess with the pacemaker and adjust the accelerator or the brake based on whatever it wants to do. And we saw that in there as well, and that's just because Chagas loves to eat up the nerves, whatever tissue it wants to, but mainly in the heart, it likes to mess with the nerves that plug into the heart. Okay, we'll do the next slide. Again, not that you're veterinarians here, but we basically started Chagas treatment, but we also started regular heart meds, okay? And this brings up a really important point. Just because we have Chagas, we don't just ignore all the other issues. So this dog has a bad pump. I still have to address that. So this dog's going to go on our typical heart disease medicines, and you can see some of these, and some of you with dogs with heart disease, you're going to recognize these drugs, okay? But we're going to add in an additional 2 drugs, the amiodarone and itraconazole, to start killing the parasite. So, and we do our little follow-ups and things like that. We monitor drug levels to make sure they're therapeutic and they're not too toxic or too low. You know, the worst thing that can happen is we diagnose your dog with Chagas disease. We treat for an entire year and I have to come back and go, oh, I'm sorry, we still have it. I was at the wrong levels. So about a month into treatment, we always circle back around and make sure that our levels are good. Okay. And then we follow up the EKGs to make sure that those arrhythmias that we saw in Remy went away, make sure that the parasite goes away. And Remy, this was 2 years ago, so Remy is doing amazingly well and has a perfectly normal heart now. The echocardiography showed 23% now, so we went from 10% to 23% after treatment. No more arrhythmias. She's doing awesome. So good outcome. That's a good story. All right, next slide. All right, so this is Princeton. Princeton's no longer with us anymore, but I had to put Frenchie in there, you know that. This dog was the #1 dog in America for Frenchies. And so he has a lot of babies across the world. But Princeton lives with a bunch of ladies, of course, because he was a stud. And we had a couple of them that had Chagas. So Princeton had come in and we had screened him a few months before, just on wellness checks. Yeah, he was negative for Chagas. Well, then Princeton started having seizures. Okay. So he went to the emergency room because this stuff only happens on the weekend at midnight, right? So they went to the emergency room. They went through a full workup. They sent off every infectious disease panel known to man except Chagas disease. And I love our neurologist here in town, but for some reason it never makes it on the list. So anyways, Princeton comes to me. We go through everything. He's literally negative on everything. Okay. He has a high white cell count, and that's it. Okay, like that really helps us. Okay, they did an MRI, they did a CSF tap. I mean, they did the full workup on this guy. And to be honest with you guys, in their fairness, like, you know, he's 9.5 at this age. A 9-year-old Frenchie with seizures. I mean, the first place we're all going is, oh shoot, brain cancer. You know, so MRI really needs to be on there. And so they did all that. We did a Chagas test. I don't remember why I did the IFA. I think because we were already sending out blood to the lab for some reason. And so we just ran it. Regardless, he came back positive. And so the only thing that we had that was abnormal on this panel that we checked for every infectious disease known to man was Chagas disease. So the interesting thing, and we'll look at the MRI next, they found some fluid in there. And we can go ahead and go to the next slide. We actually had to call the radiologist and talk to them about this. And don't worry about this little blurb here, but basically what it's saying is this little spot, and if you look really closely, you can see some crosshairs right there in the brain. This is a little black circle. And on the sagittal, which is the cut side, you can see another little black circle on the right side of your screen, just below those two little teardrop things right in the middle. That's a hole in his brain. And basically what happened was the T. cruzi caused a clot or a stroke, and it killed off that area of the brain. So this dog's walking around with a hole in his head, okay? And Frenchies are not really known for doing higher math, okay? They're not that smart of a dog anyways. And so even though he had this hole in his brain, it really didn't impact his behavior that much, which says a lot, but no, he's a sweet dog. But basically, yeah, Chagas caused a hole in his brain. Now, since then, since Princeton, I've lost count with how many dogs that we've had that have the same exact lesions from Chagas disease, okay? And we know in humans it causes stroke. It's one of the leading causes of death. We just don't really identify stroke that often in dogs, mainly because they don't have coronary heart disease, but there are other diseases that can do it, and certainly Chagas is one of them. So long story short, we treated Princeton. We only had to treat him for 6 months. That's one of the benefits of having neurological disease with Chagas disease. You only have to treat for 6 months, okay? It clears it consistently in that amount of time. And got rid of his seizures. He did have to use one anticonvulsant long-term. Again, he's got a hole in his head, and so those neural pathways are disrupted, and so he tends to fire a little more frequently. So he did great until he passed away. So, all right, next slide. This last case is Bella, and she's a great healer, man. She was an awesome dog. I think she's still alive. She presented for blindness, acute blindness. So one day she can see, the next day she can't. And talk about scary for the owners, right? And so she came in. She had a fever prior to that, a couple months before, with some diarrhea. No big deal. We did some antibiotics and penicillin, knocked it right out. You know, dogs get diarrhea all the time, right? But when she came in, she had this red eye. You can see how red it is. There's a little bit of orange staining on there. That's because we stained the eye just to make sure there wasn't any ulceration or any abrasions in there. She had high pressures in that particular eye, on the right eye, and that signified glaucoma. Okay, so we diagnosed her with glaucoma. However, she also had inflammation in her eye, inside the eyeball as well as in the outside, and that diagnosis is called uveitis. So basically, we've got an inflamed eye. It's so inflamed that it can't drain, and so the eye gets bigger and bigger and bigger, and those pressures go up because it can't drain, and that's where we get the glaucoma. Okay, so we'll do next slide. She was also losing a little bit of protein in her urine. So we did an infectious disease screen. Okay, it's actually the same one we do for seizures. Basically, we're negative on everything except for Chagas disease. Okay, super hot positive. In fact, the lab just gave up because it was so high. So we had a truly an acute Chagas case, which is pretty rare. Okay, we'll go to the next slide. So we did again, just like with the heart with Remy, we do typical treatment for glaucoma. Okay, it's not like we have Chagas, we don't use any of these drugs. Okay, so we used our typical drops. We started on a steroid because of the uveitis to get the swelling and inflammation down, and then we started on an amiodarone and itraconazole. Okay, we did a recheck at 30 days. The pressure in the eye maintained, it had gone down a little bit, but it was still too high. Okay, so she was not responding to that. And so our plan was to go ahead and just remove that eye and send it off, okay? Because we had never had a dog with glaucoma with Chagas disease before. Okay, we'll go into the next slide. And this is kind of a crazy slide here, but I'll explain it to you. We'll just advance it when you can. There you go. Oh, this isn't the crazy one. The next one's crazy. But basically, took the eye out, sent it off. The short of it was her other eye recovered fully after treatment. She could see completely in that eye again. And then we had no parasites at the end of that. Okay, but we did have to take out her eye. Okay, we'll go to the next slide. Okay, this slide's the weird one. Okay, so this is basically if you took the eyeball and you chopped it in half, and we're looking at just a slice of it. Okay, so the pink is the actual globe. Okay, so that's the structural component of the back of the eye, because it's round, right? So it's just that piece of section. That purple that's floating in space there is supposed to be stuck to that structural support to that globe. Okay, this purple is actually the retina. Okay, that's the sensitive, that photosensitive part that takes in vision, right? And this dog had a detached retina. And it's really, really purple because remember from our slides with the heart, with all that inflammation, that's exactly what's happening. So the Chagas went to the back of the eye, to the retina, set up shop, the body inflamed all that, and through that process, detached the retina and caused vision to go away, caused blindness, okay? Fortunately, the other eye, which had the same thing, didn't detach, and so we were actually able to save the eye and save the vision. Once all that inflammation went away, because we killed the parasite, the dog could see again. And I've probably had like 4 cases, I think, in 20 years of acute blindness. And with the exception of this dog, they've all got their vision back. You just have to identify it and treat it rapidly, before you get this happen. Okay, so just kind of interesting. No one's ever looked at that before. It is certainly not on the list of things to do, and it was interesting. We'll go to the next slide. All right, so some of you, I'm sure, and we're just wrapping it up here, and we'll get questions here in a minute. Some of you guys have horses on your land, and they are not immune to Chagas disease. Okay, we certainly see it, and I don't particularly work on horses, but I have a lot of colleagues that have diagnosed Chagas disease in various presentations. Yes, colic, yes, heart disease, and heart disease is pretty rare in horses, but we've seen it. Neurological disease. And I put this, just this case study, only because it was written up at A&M, a 10-year-old horse that presented with progressive ataxia or wobbliness. And, if you've lived in Texas for a year and you have a horse, that EPM, that disease, is rampant out here. And so that's kind of the working diagnosis on anything neurological on a horse that comes to A&M because it's so common, but he was negative. Okay, so unfortunately, the horse passed away, and they did a necropsy like they do with most of their animals if they don't know why they died. And they did find inflammation in the spinal cord and they found the organism in there, which is really cool. So that was actually the first case reported in a horse officially with neurological symptoms from that. So we definitely see them. I'm sure the horse ate it, okay, in the feeding trough. Think about in your barns, with all the feed in there and all the rodents that come. Well, guess what's following? Those kissing bugs, and those fly strips aren't going to catch those guys, okay? So that was kind of an interesting one. Since then, or in addition to that, we've seen it in so many different species. We've worked with SeaWorld with treating theirs. That was the biggest animal I've ever treated, was that walrus right there. And he did great. He did awesome. We also have, multiple species in zoos. Non-human primates, oh gosh, there's so many non-human primates that have Chagas disease across Texas. It's insane how many we have. And I don't know if you know this, but Texas imports more non-human primates for research than any other state in the country. And then they kind of get distributed from here. And it's mainly, South Texas, Alice has a couple of facilities there. And we're constantly dealing with Chagas disease in those guys. They're bored, they're in South Texas, they're going to eat bugs. And so we see a lot of those in the zoo, certainly are expressing those concerns. We've had, a lot of exotic owners. I've treated a couple lemurs, which are really fun. But and the sun bear, I think that was at the Waco Zoo. I can't remember, but man, when you start looking for it, you find it, and they have lesions. Okay, our chief pathologist has necropsied multiple great apes, orangutans. I think he might have had one gorilla, but heart lesions very similar to dogs and humans. Makes sense, right? So, okay, we'll do the next slide. All right, and we'll just advance one more. Okay, so just some key takeaways for you guys to take home today and spread the love and education. Chagas disease is treatable, okay? So it needs to be, as a veterinarian and as a patient advocate, to your veterinarian, we need to be checking for this, okay? So, any dogs or cats with heart disease need to be screened. If you have a dog with Chagas or a cat, you need to test all mammals in that environment. So horses included, and cats, and then certainly people, okay? And that is our recommendation from the State Department. They are always on us, hey, this one has Chagas. Did you talk to the owners about it? Are they going to go get tested? And I've only had, in 21 years of doing Chagas work, I've only had 6 people test positive, okay? It sounds like a lot, but like just thousands of dogs, okay? It's pretty low prevalence in people, but those people would not have gotten tested, and the craziest story I've ever had was a vet. He told me this in Corpus. His elderly couple, gentleman dies 2 years before. Their dog gets diagnosed with Chagas disease. They have the conversation. She gets tested. She's negative, but she's like, my husband, who was like 81 when he died from heart disease. Do you think it could have been Chagas? And he was like, yeah, it's possible. Your dog has it. You're certainly in the same environment. And she had her husband exhumed. And 2 years later, insane. And when they did an autopsy on him 2 years later after he passed away, and they found it in his heart, and he actually died from Chagas disease, and no one knew, because he was 81 years old and he died from heart disease. So that's not surprising, right? Nobody's going to think about that. So highly recommend, humans get tested, and I'm going to have a little letter you can take a picture of, or if we send you the PDF, you'll have a copy to give to your healthcare provider if you want to get tested. It's got test codes on it, things like that. And then the last thing is, you do have control over reinfection or vector control. Okay, so get out there, spray your environment, get your dogs on the Bravecto or NexGard or whatever you want to do. But try to control these vectors, okay? And you'll notice a really big drop in your population of infections. Okay, we'll do next slide. The other thing you can do is submit kissing bugs. So the CDC has, it had allocated funds to, I don't know if it's still there, it might have gotten doged, but they did allocate funds to the State Department in Texas, in Austin, to test kissing bugs for Chagas disease. So if you want, here's the link. You can send in your kissing bugs in just a little Ziploc bag, and then they'll test it. They test it for 2 things. They test it for human blood, and then they test it for T. cruzi, okay? That's kind of the spin, right? They're like, yeah, we'll give you money if you make sure there's been human exposure. So, and this is a free service. It takes about 6 to 8 weeks to get the results back in, but it is helpful to kind of know, in your environment if you have it. Certainly makes a good argument for testing your dogs, right? Okay, we'll do next slide. This is a copy of the letter that I give to all my Chagas positive owners, and they can hand this to their healthcare provider. And it has all the test codes, because that's been the biggest concern that we get feedback from healthcare providers is like, I don't know what test to do. What's Chagas? I vaguely remember it. We don't have it here, do we? It's one of those things. So this kind of helps cut through that. And if you go, I mean, you're your biggest advocate, right? So you just show up and you're like, I want to be tested. I don't recommend doing this at the cardiologist unless you have a really cool cardiologist, because they tend to be a little opinionated on whether we have it or not. And so you might get a little bit more pushback there, or blatant refusal. But the family practitioner is freaking awesome, man. They want to learn, they want to get out there. So this is a good thing to hand to them. We'll do next slide. And this is the last thing, just so I can remind myself to tell you that there are different opinions on, treatment and what we need to do with Chagas disease, and they're not always in the best interest of your pet. So this is a specialty clinic up in Austin, cardiologist only. And I'll put this in there. This just got sent to me maybe about a month ago from one of our clients that's on treatment. Her 2 dogs have Chagas disease, okay? And the cardiologist's recommendations were to get rechecked in 60 days. So they did. And this is what her response is, and I'll summarize it for you. So basically, yep, they're still positive, and they're likely to both truly be Chagas positive. I mean, she just won't come out and say, your dog has Chagas, because that would be honest and direct, right? And then she goes to say that, unfortunately, this sucks, and most die within a few years of diagnosis, which is true. And her recommendation to the owner, okay, so remember, everything, more about Chagas than most vets after this presentation, okay? But knowing what I'm going to read what her recommendation was. This is as good as it gets, guys. Given concerns about progressive cardiac changes that can result from Chagas disease and the variable prognosis in dogs that are Chagas positive, we would recommend treatment? No. Rechecking the Holter monitor and echocardiogram in 6 to 12 months, depending on how aggressive you want to be. We're sorry for the sad news about both of them today. Have a nice day. Dr. Cardiologist, okay? How does that help anybody, okay? That's a problem. So we know that the majority of dogs are gonna die within a few years. She even says it right there. And so the best I can give you as a veterinarian is just to keep coming back to me so I can watch your dog die slowly. And that's not okay. And that's why we're doing these talks right now, because you truly have to be an advocate for this. And this is happening currently. So, get out there, spread the word, and hopefully, we can test these dogs. Okay. The best thing you can do in your environment, your microenvironment, whether you have 2 acres like me or 2,000 acres, is to, test your mammals, okay, treat them, and then treat the environment, and your numbers will go down. You're going to be wrestling with it your whole life, but you're going to go from, 20, 30, 40% positive, and you're going to get those numbers down 5, 10%. You're going to save some animals. Okay. So we'll do the last slide, and that's my contact information. If you guys want to email me, these are my 3 dogs. So that's Buddha on the right. He's now 15 and a half. And then Rip, the GSP, and then Daisy, the golden. And all 3 of them had Chagas. So I've been through it. I've been on that side with you guys, And Daisy at 2.5, when we were spaying her, she almost died. So she had that arrhythmia that I showed you, that fatal arrhythmia. My staff is amazing. And they saved her while I was doing my work. And then I immediately tested her. She was positive. I tested everybody else. They were positive. And now she's been off treatment for 2 years now. And her heart is perfect on her Holter monitor. I mean, she went from near death to now perfectly normal. Now she's super obnoxious, typical golden retriever. And even my 15-and-a-half-year-old pug, man, he's still kicking. And he, after about 60 days of treatment, he just blossomed and turned into this puppy again. He's super annoying. So it's really good. But shoot me an email. I'm open to questions now, and I think they're going to read off the chat to me, and I'll just answer questions. And again, I'll stay as long as you want me to, and we'll kind of have like just a discussion, free form.
All right. Thank you very much, Dr. Madigan. There was so much good information, and we do have quite a few questions too. One, you did answer when you said something about your pug in 60 days, because one of the questions was how long treatments usually last, and then what costs are associated, and is there any type of insurance coverage, not knowing how expensive the treatment is.
Yeah. Those are really good questions. And I fortunately I can answer to the insurance thing. I'll do that one first. It depends. So, there's a lot of different dog insurance and cat insurance companies, but generally what I'm noticing is that they will pay for, the diagnostic, the workup, the treatment. It's variable because it's not FDA approved yet. We're going through the process right now. And so, but generally they'll cover it. I have had one insurance company, they said, no, we're not going to cover it because it's a parasite and that was preventable. Oh, boy. So that took months of them, going back and forth. And we had to write a little letter. Hey, Chagas isn't preventable yet, or it's not the owner's fault. So it's kind of dependent on that. And that might be something that you could ask, your insurance company. Hey, if my dog gets diagnosed with Chagas, are you going to cover that? And most of them do. Okay. I think that was an exception to the rule. As far as cost goes, it's really not too bad. The average dog is about 20 kilos, so 45 pounds. And so for like an average dog per day, it's probably going to be about $1.50 a day, and you got to treat them for a whole year. And you can spread it out. So it's not too bad. The 28-day check, where we're doing blood work, we're checking the itraconazole level to make sure that it's accurate and where it needs to be and efficacious, not too high, not too low. And we're checking the liver and the white cells to make sure everybody's happy under the hood, with these 2 drugs that we're doing. That's an initial expense, and that can, run you around $300 for that 28-day recheck. But then you've got 11 months of just coasting. Okay. I tell people it's like prison. You're like one day at a time. And, my dog, all 3 of these jokers would line up at the bar after dinner and they'd wait for their pill pockets to get their drugs. And it's kind of entertaining, but man, 365 days is a long time, but you'll eventually get through it. And then the duration, it depends what stage we're in, but for all intents and purposes, most dogs, like 99% of them, it's going to be a year treatment. Okay. It's just, they're in that chronic phase, they don't have a big dilated heart. They don't have any too bad of arrhythmias, and it's just going to be a daily occurrence. At the end of treatment, we're doing the 2 PCRs, and we're generally doing a Holter monitor. So that can run you anywhere from $250 to $500, if we're doing that. So, but that's like we're like signing at the end. You're like, okay, good, we're done. And it's so nice at the end to have that sheet of paper that says, I didn't find any parasite, or hey, my Holter monitor looks really, really good. And you can cut some corners. You don't have to get the EKG or the Holter monitor. You can just start treatment, right? I do recommend that 28-day recheck though, because we can do, if you stayed on too high of a dose for 6 months, that liver could get slapped around pretty good. They'll start losing weight, vomiting. We don't want that to happen. Okay. So I think if I had to cut corners, I'd do the electrical assessment. I would probably put off, if that answers your question.
Yes. And another question was actually from Daryl McInerney. He asked, once a dog has been treated and free of Chagas, do they have resistance being reinfected? Do they have resistance?
And that's Daryl. That's a great question. Actually, somebody asked me that about 2 weeks ago in the exam room, and the short of it is we don't know for sure. So this is just my opinion I'm going to give you, but obviously this might change. But I don't think immunity is enough to prevent infection. Okay, but I do think immunity is enough to lessen and mitigate those symptoms that we see. Okay, so what I mean by that is that if you've had Chagas before, you get through the treatment, you're clear. Okay, you get reinfected because you're a dog and you eat a bug again. You're going to have less severity on signs. Okay, so you're not going to go into full-blown heart failure. You're not going to have a fatal arrhythmia. It's going to do some damage. It's going to set up shop, but it's not going to be, the body's going to be more efficient at walling it off. Okay, and the reason I say that is because when they looked at the vaccine, when they were doing vaccine development, and we helped them with this. Look, all I did was send them samples. Okay, I'm not that smart to do all that stuff, but they were injecting these dogs, and they would watch the immune response. They weren't just watching to see if they got infected, okay, or what their hearts looked like after they euthanized them to see, but they were looking at inflammatory markers and a bunch of different ones, okay. The dogs that got vaccinated, even though it didn't prevent infection, they had less of a robust immune response, okay, and they didn't die, or I shouldn't say that, they didn't get as bad of disease, okay. And I think we see that a lot. I mean, like Bordetella, kennel cough vaccine, that's a classic example. Like, it's well known that it really doesn't do a good job of preventing symptoms completely, but it'll lessen them. So your dog won't get full-blown bronchitis or pneumonia, but it'll have a stupid little cough or something like that. So I think it's probably the same way. I mean, you've had a year of treatment, you've had a year of these antibodies being produced, the body's fired up and producing more because you're killing the parasite with the drugs. You're going to get a pretty robust immune response, and it should be a little protective, but I think they're still going to get it.
Okay. And then Daryl actually did a follow-up question too. As a best practice, would you recommend testing puppies every 2 months to catch them in the acute phase and limit the treatment to 2 months?
Yeah, that's another good approach, and we're kind of still hashing out that on like solid recommendations. But so the theory is this, okay? The acute phase is defined as I've been exposed within the past 8 weeks, and so the theory is, if I test every 8 weeks, there's like no way it's ever going to go into the chronic phase. You're absolutely right, and I have clients that come in every 3 months. Okay, so it's not every 2 months, but every 90 days, they're in the door and we're doing a Chagas test, okay? And they're like, we want to catch it in that acute phase. We want to catch it before it gets bad again. And I think that's a great idea. I mean, if the budget allows for it, if you don't mind coming in to see your vet for that, absolutely, it's the best way to go, okay? In fact, I would do a PCR in that case, because remember, in that acute phase, it's 100%. And there's good studies even out of A&M that said, oh, hey, we didn't have any antibodies, but we found it on the PCR. Okay. That usually indicates it was really early infections. It hadn't quite made the antibody or enough of it yet, but boy, that PCR grabbed it. So PCR every 2 months, fantastic idea. In dogs, so if you're breeding and your bitch delivers and she's positive, okay, and this has happened to me. It happens unfortunately a lot, but like, we diagnosed the dog with Chagas and she's pregnant already. Can't do treatment, okay, because these drugs haven't been studied in pregnant dogs, but we know in pregnant people that it can cause like low birth weight or worst case scenario, like an abortion. So we're like, let's just not even roll the dice on this, okay? So in those cases, I'll be like, hey, the minute these puppies hit the ground, I want you collecting cord blood, okay? And so they're getting the placenta and they're bringing it out and stuff like that. And so I'm going to run a PCR on that, okay, immediately. And then I'm starting mom on drugs immediately. And the theory is that some of those drugs are going to get into the milk and go to the puppies, okay, to some degree, if there is some parasite, that the puppies got. But also my PCR, while it's running for the week, I got to wait a whole week for it, okay? I don't want to lose any puppies in that time. I'm kind of covering our butts there to make sure that we don't have any puppies with the parasite.
Great. And then another one that Daryl asked was, what other ways are dogs infected? Since dogs can get Chagas from Chagas feces or from kissing bug feces, can they get Chagas from the feces of other infected animals?
Yeah, and we haven't looked at that yet. I'm really pushing for it right now. And again, I'm not a molecular guy, but with PCR, that's how you have to find it, right? What they've told me, and they're going to figure it out, because I'm relentless with them, because I'm like, you got to find it in the poop. There has to be another condition somewhere. But they told me, feces has so much noise on PCR. I mean, there's other stuff in it that's going to amplify instead of the Chagas, and so it's going to be confusing. I'm like, well, you guys need to figure this out pretty quick, because we need to know if this is transmitted. I 100% think, just my opinion, but I 100% think that it's spread by feces of dogs. Absolutely. It's the only way to explain how whole kennels get it. Like I have this Cavalier breeder, and she's incredible, like incredibly clean. Like, she does everything right. But son of a gun, I mean, like 8 of her 12 had it, and I'm like, how is this possible? And granted, they're around each other when one of the bitches is in the heat, and we know that blood transmission happens, and everybody's licking everybody, right? It's disgusting, but that could have been a transmission for sure. But it's got to be something else. mean, Cavaliers go outside and they pee and poop and they come back in. I mean, they're totally companion dogs. So I think it's in the feces, and hopefully more on that later. I'm still pushing for it. Hopefully we'll be able to isolate it. All we'd have to do is isolate it. But like with stools, I mean, it's normal to have blood in the stool sometimes, microscopically at least. I'm not talking like a gusher, but they got blood in their stool. We know that's a transmission. Just like we thought that we could find it in the saliva because of gingivitis. So you got gingival inflammation, a little bit of blood, these dogs. And but we did, I think it was only 30 samples of dogs with Chagas. Big goose egg on that on PCR of saliva. So I really don't think it's in the saliva. So that really only leaves poop. So more on that later, hopefully.
Okay. And then this kind of pertains to it. One of the questions was, what are the quarantine practices? Since it does sound like it's contagious, do you just keep them in the kennel, or you board them? And how long would they be contagious?
Yeah, so they are contagious, but Chagas does require that vector, that kissing bug vector. So they're contagious in that sense. So if there's kissing bugs on the property or in the boarding facility or wherever, if that bug bites it, yeah, you're distributing Chagas throughout the kennel that way. But as far as direct transmission, it's really, really hard to do that. Okay, you can make a story where blood to blood transmission, so the dogs get into a fight and there's blood everywhere, and then yeah, that could definitely do it. And they're licking their wounds and they have some of the Chagas blood on them from the other dog, and they get it that way. You could totally make a story that way. And again, vertical transmission from mom to baby and blood transfusions, but we don't transfuse dogs too often. And then eating dead animals that have Chagas. So like the possum or the armadillo with it, they're eating the dead thing and then they get it that way. I mean, those are really the only ways to do it. So, but I do tell people, if your dog has Chagas and you're really worried, okay, so, and I get this sometimes, oh, my daughter's coming over and she doesn't want to bring her dogs, kind of thing. I'm like, okay, fine, start treatment. And we know 100% that within 2 weeks of starting treatment, we can't find the parasite in the bloodstream. So they're not contagious at that point, which is helpful. Okay, again, you're breaking that cycle. So that's what I would say about that. It's a good question. But also on the quarantine thought process, so if a dog is coming, let's say you guys spend half your time in Philadelphia or something, or Pennsylvania, you're up north, okay? Quarantining a new dog that you get from a southern region with Chagas is a good idea, but I would probably quarantine in the sense of like, let's just make sure you're not, if you have an intact bitch, you're not bleeding everywhere or something while I'm doing the Chagas test, okay? And that's the most common thing that I see with like quarantine situations is they buy a breeding bitch from the south and they live in the north, and I'm like, hey, just screen them. I mean, it's the same thing that I see with dogs that come over from Europe. Like I'm screening those suckers for leishmania because that is not a requirement for USDA for some reason. But yeah, we import and have imported a lot of dogs with that particular disease into this country, but again, because we're not testing for it. So but you're fine. I don't think I would like quarantine in the sense of like locking them up in a cage or anything.
Okay. And then we have a couple more because I know we're getting close to the noon hour. And one of them is similar to what you just mentioned. What policy gaps are slowing down effective tracking or treatment of Chagas cases in the U.S.?
Man, I think it all starts like the root cause. Okay. So while 99% of veterinarians don't test or look for it or don't know much about it, the root causes are vet schools. Okay. They're still teaching it incorrectly. They're true. And this is how I was taught. Any new associates we have, I always ask them, I'm like, so what did you learn in parasitology about Chagas? They're all taught the same still to this day. And that is a disease of third world countries that you have to live in a thatched hut. Your dog has to be, traveling to Guatemala routinely. I mean, completely wrong. And then you go, well, maybe it's a veterinary thing. No, it's not. Oh my gosh. The CDC still thinks the only cases of Chagas in humans is from immigration. I mean, they really believe that. I was just on the World Chagas meeting yesterday, and I'm just going, oh my God, it's mind boggling.
Wow.
Thought process, So it's not a simple answer, but it has to be changed at the vet schools first. Okay. So all new grads are getting out there with it. Things like this. And I speak to vets a lot, but we need everybody on board, right? To be giving the same message. And then you guys, I mean, I can't tell you how many vets have been educated, me too, on some diseases, absolutely, by owners. You come in and you're like, hey, I just saw this at STPRA, and I want you to test my dog for Chagas. And yeah, sure, we'll test him. And then they test, and oh my gosh, it's positive. Now what do I do? Well, then we have a conversation, and then that vet going forward, now I get it. Now I'm in my first case. I walked through treatment. I know what to look for, and now I'm testing for it. We get emails all the time about that. All they need is one case, and that's what happened to me. I mean, I got out of vet school just like every other vet out of Texas A&M, and it was like, yeah, it's, do you live in a thatched hut? No, I live in a gated community overlooking Lake Austin. Oh, well, you have Chagas. It's like, oh shoot, you mean the gate didn't stop the bug? But those guys, that has to change. And I didn't know we had it until I had a dog come in that had severe heart disease. He ended up dying. His name was Max. He's 1 year old. And I was like, what happened? And then I sent his heart off because I wanted to know, and they let me, and I got it back, and I'm like, Chagas? Like, what? We don't have that parasite here. And so that kind of opened up that whole process for me,
Yeah. No, I hear you, because you said it perfectly too when you said, does the gate stop it here? And it doesn't. And all the research that we've done over the years, reading various articles, it's always, like you said, the third world countries. And it's not. And we're seeing it at home and in our families. And just a black lab we had, 6 months old, trying to wake it up the next day. It was just, thought it was asleep in the bed. It wasn't. She had consumed a couple. And so it's a very important topic, and you coming on and taking the time to do your presentation is priceless. And we're very thankful, that's for sure, to get this information out there.
Oh yeah. You're welcome, Lacey. No, thank you guys for having me. And, do you guys have any more questions, or do you want to, you can email me, whatever's easiest. I mean, I'm happy to stick around a few more minutes. So if you need me to.
No, I think we're good. Just whatever,
Okay.
Contact information, I think you put on that last slide for anybody that has any various questions. And then you mentioned about sending these slides, and we can share those with our members. So that would be amazing.
Okay. Awesome. Well, thank you guys. And, yeah, we'll talk to you soon, and hope to hear from some of you. Okay.
Okay. Thank you so much, Dr. Madigan. Appreciate it.
Okay. Bye.
Bye.